Get ready. You're about to experience the life science effect. The most influential players in the biotech, pharma, and medical device industries, bringing you their insights and inspirational stories. Are you ready to boost your career? Ready to set your medical innovation in motion? You have arrived at the right place. Every week, another industry leader, more insights, more inspiration, and tips you can implement right away to make your mark on the world. And now, here's your host, life science veteran and senior leadership consultant, Steve Vinson.
We're here with Scott Johnstone, CEO of the Scottish Lifesciences Association. Welcome.
Thank you. Thank you for having me.
With that, why don't you tell us about your background and the association and anything else you want to do?
So I'm an engineer. So if you go right back to basics, so engineer, started my career in big pharma, and after 5 years and some acquisitions in that role, I decided that it was more fun being acquired than to purchase. So did an MBA at that point. I was based out in California, so previously in Switzerland and then UK. Did an MBA and then flipped over to starting my own company. So since 1996, I've started or been involved in about 15 startup companies.
Oh, wow.
And it's in life sciences, that's pretty diverse. So that's everything from veterinary diagnostics to my latest one, which is a consumer health product. But we've just launched that in the market and it's going well, so we're looking for other things. But along that path, we as kind of entrepreneurial companies set up our own trade body in Scotland. So in 2011 we decided that we weren't engaged enough with the Scottish Government. So the Scottish Government is quite young, but it's getting more powers devolved. So we have control through the government of health, the economy and education. And we felt that we weren't really engaged as industry at that point with those three key areas. So 15 of us decided that let's set up our own trade body and let's do it differently to the other trade bodies. So the first thing we wanted to run it ourselves. So we didn't want to have to hire people to come in to run it. So we set up a model or a structure whereby the members actually are driving the agendas and they're working towards solving problems for all the members. So part of it was still engagement with government, but it's much more about how can we help each other grow our businesses. So that was 2011, 15 of us. We're now 2018, there's 130 of us. We still run it ourselves. We have 18 special interest groups, all chaired by the person who is most relevant to run that group, and they're just helping each other. We have all the universities as members, but that's not from a technology transfer point of view, that's from a graduate employability. So we work with the universities on their curriculum to make sure that the students coming out of universities are fit for industry. Because if we're going to grow our companies, it's going to be people.
Right.
The other thing to help that is money. So we have 12 investor members as members of the SLA. So there's no excuse that, if you have an idea or a business and you're saying, well, I can't get money, we're saying, well, your proposition's wrong. So come in, we'll help you with that proposition. We'll tell you if it's never going to fly, we'll tell you that early, because there's no point, we're all bright people, so if it's never going to fly, stop it, go do something else. Yeah. So the market in Scotland is the National Health Service, so we only have one customer in Scotland.
Oh, right.
And we weren't really that engaged with the NHS. We just saw it as a very difficult organisation to penetrate and to sell into. And it meant that most of our products are designed for overseas and mostly for the the biggest market, which is the USA, and that's why we're here. So we're here to
being chased by China, probably, right? I would imagine.
No, still the US.
Okay.
The US is our biggest market. It's a relatively easy market for us to get into. We speak the same language. We're all kind of fixing the same goal. We all want to improve healthcare. So there's a lot of shared kind of aspects to that makes it.
It's a good point.
Really
I
easy.
suppose China has their own version of a national health program.
And it's more like ours. So ironically, if you were looking at the market,
Yeah.
then China's probably the one to go to. But actually, because it's very difficult, we know it's difficult to get into a socialized medicine market space. It's much easier to get into the private.
So somebody who's listening who lives in the States and what has sort of an entrepreneurial mindset, but they haven't done it yet.
Yeah.
I suppose you could say you have all the advantages you need because you live in the market that is the best in the world to be selling into.
Absolutely.
So what should they do? What would your advice be to somebody sitting around, maybe they're working at a desk at a large corporation and they think, man, I'd rather make a difference as an entrepreneur?
Yeah. So, I mean, that's one of the key reasons we set up the SLA, because you need to go and speak to people. You need to speak to people that have been on that journey and find out what that journey is like and learn from their mistakes. So that's why we set it up, so that other people don't make the same mistakes, because we've all made mistakes. We've all had failures, and that's just part of the journey. But if you can learn from someone else's mistakes, then it gets you, closer to the end goal and making your own mistakes. But if you can speak to people, so get out there, speak to people that have been there and done it, and speak to people that are genuinely interested in what you're doing. So just don't speak to people like, oh, that's a great idea, go and do it.
Yeah.
It's brilliant. You need people that say, well, this journey is going to be quite tough. Here's what my journey looked like, but if you don't like that one, go and, if your idea and you want to get into healthcare, well, what part? Is it diagnostics? Is it digital health? Is it pharmaceuticals? And then you can speak to people that have done it. So we have, across that spectrum, the wide range of people who have done all the different aspects of life sciences, so you can learn from these people. And again, I think what you've got here in Indiana is a much more nice is probably a good word for it. Everybody here is very nice, and that's great. So you're not going to be up against people that are like, well, actually, I don't want you to succeed because that makes me look maybe a little bit less important or whatever. You need to get in an environment where that goes away. And having nice people, so Scottish people generally are seen as quite nice, and we are quite nice, but if you're doing something wrong, we'll tell you.
That's the part, it's an interesting point to bring up, because as a native Hoosier, you've learned what a Hoosier is.
Yeah,
right?
yeah.
Okay.
Yeah.
I'm not even sure what a Hoosier is. So
yeah, I thought it was something to do with socks.
Other than a native Indiana person. Socks or
somebody knocks on your door.
Somebody knocks on your door and say, who's here?
Yeah.
Anyway, as a native, but I'm from what they call the region, which is Northwest Indiana, very close to Chicago, very much more like a Chicago suburb than like Central Indiana. What I've noticed is everybody is nice. Absolutely. Yeah. What I worry sometimes, though, is they won't take the second part, which is if you're doing something, if you're headed for a cliff, they're so nice, they don't want to offend you by telling you you're about to drive off a cliff.
Yeah.
Right?
Yeah.
So how important is that in Scotland? And how has the culture developed to be nice, but not kind when kind isn't what's needed?
Yeah. Yeah. Well, that just comes through trust. And if you build that relationship, start with nice, then get to a position of trust, and then people will give that advice. And we've seen that at the SLA. There are more and more people will come in and they'll give you that tough love, and that's all it is. It's a parental thing, And
tough love.
If you've got kids, then you know what it's about. And
they don't think I'm nice, though.
Yeah,
my kids don't think I'm nice.
Well, that's part of being a parent. But,
yeah, that's absolutely true.
So that you just need to get to that. Yeah. I mean, you're not being cruel or anything like that. You're just saying, well, can you answer these questions? And the person comes back and says, well, no, I can't. Well, you might not have a business there.
Yeah.
And there's no cruelty to that.
No, there's nothing nicer than helping somebody in that way, right?
Because we've got loads of opportunity. Healthcare is just, it's
Yeah.
just the land of opportunity. And, you know, if that's not going to work for you, just go and do something else.
Well, and not just a financial opportunity, but if you're someone who wants to help others, there's no bigger leverage that I can see than healthcare right now.
Yeah,
So
absolutely. I mean, we're lucky. We have, you know, our 12 investor members, and a lot of them are business angels. And you know, if you've got a proposition that says, well, I'm going to do a bit of fintech, and you know, that's where it's going to fit in, and it's going to help that insurance company to do something. Or you get somebody that I'm going to do a bit of digital health with my software skills, and actually it's going to look after your parents or you. You know, it's going to make sure that if you're going to get some kind of an indication, a disease or whatever, or a condition, that you're going to have something that, you know, there's going to be a community round about you. Maybe you don't see it, but it's going to be there with technology.
We are very proud to have the support of the Indiana Health Industry Forum here at the Life Science Effect. They have been with us since day one. IHIF provides guidance and leadership on public policy issues that contribute to innovation in the health science sector, deliver therapies to patients in need, and further the development and growth of their member companies. IHIF also works with the government and other groups to support specific initiatives and legislation. Also, if you need a connection in the health industry, give them a call. Go to ihif.org and they will hook you up. They have been a tremendous supporter of ours, so thanks again to the Indiana Health Industry Forum. Go check out ihif.org and support them like they support our life science community. Now, back to the show.
since we have limited time, I know you're here to meet potential collaborators in Indiana and to take them back with you to Scotland. I'll cut to the chase. Talk a little bit about your 15, 16 companies. You're working on your 16th or 17th that's going to be successful. What words of wisdom do you have from a leadership perspective that what's allowed you to be successful?
Well, it's all about people. So it's about spotting the people that are going to help you and spotting the people that maybe are not going to be so helpful. Mm-hmm. You can't do it on your own. But you can do it with smaller and smaller teams. So the virtual company model is very good in Scotland because we have all testing services. I'm sure you have them here in Indiana. So you can take an asset, be that a diagnostic, a device, or a drug, and you can use the contract research mechanisms to put that out. But you still need a core team of people. And it's about being able to select those people to then let them, because these people have got to be better than you. And not to be afraid of that, because they will be. So if you're going to bring somebody in that's going to be a better salesperson, give them their head and trust them and leave it at that. And you're kind of as the person in the centre. You're just making sure that these people are as motivated and they're getting the things they need to do, getting the resources. But they've got to know that that's getting recognised back at the home. Trust
seems to be a theme. You've said it multiple times. So
well, that's right. That's what we're doing here with Kristen, and we've got that's a relationship now for 3 years. And there's nothing. Trust can be built over years. It can be lost in a second. So that's why it takes a lot of time in terms of doing deals with companies. You can do the deal in a second, but it's like we're not going to do that deal until we know that we're going to trust each other. Because it's, when you're taking products to market, there's going to be stuff that doesn't go very well. And if you don't trust the people that are doing that, then things go bad. So it's time, it's an investment of time. And there's not enough hours in the day.
That's true.
But healthcare is a good place to put all your hours of that day into.
What are you reading these days?
So the last book, well, the one I have I've yet to open is it's a book called Tipping Point, which is I hope it'll be very interesting.
Is that one of the Malcolm Gladwell ones? That could be.
Yeah.
Okay, yeah.
But my last book was The Black Swan.
I've heard of that one, yeah.
Yeah, so...
I haven't read it yet. Should I read it?
Yeah,
okay.
Oh, for sure. And it's just, it's where if you're going to be, because you're competing with big companies out there, so and there's only a few of you in that company, so you've got to do something disruptive. You've got to do something that's different from them. So what I learned at MBA school was everything that everybody else does. Well, that's not much use. I need to learn to do something in a disruptive way or differently than nobody else can. And it's books like The Black Swan that can give you that confidence that, okay, you might look a little bit different from everybody else, but you know what? If it pays off, healthcare will be improved.
Absolutely.
And if it doesn't, do something else.
That's a good note to end on. Let's get you out of here to your next appointment, Scott.
Perfect.
It's been absolutely fantastic meeting you.
Yeah,
and
you too.
I hope to see you again.
Yeah, we'll see you in Edinburgh.
Thank you very much.
Thank you.
You have just experienced the life science effect. Who else needs to be inspired? Tell your friends, tell your colleagues, tell your boss. It'll make you sound smarter, and it might even get you that big raise. Thanks to our presenting sponsor, BPM Associates, helping life science companies design, manage, and execute their most complex projects. Check them out at bpm-associates.com. Thank you for listening. Go to the lifescienceeffect.com website for show notes and great links. That's all for today. Now go do something amazing.